Hi everyone, how are you? This is Dr. Kim. So in today's video, we have a patient who is 14 years old and been diagnosed with a very unique condition, which you've already seen in the title. But let's figure out or find out some of the radiographic features that this patient has. So again, keep in mind the age is 14, and by that age, you should really have all permanent teeth come out by then, right? But as you can see from this maxillary arch, let me help you get oriented here. What we see is that we see permanent molars, this being number 3 and 14, and we're missing second and third molars. Okay, and then these teeth in front of it are primary molars. So these are not permanent. So we're seeing some of the retained primary teeth. And in front of these teeth, we're missing permanent premolars. So no premolars whatsoever in this area. I'll get to this one in a second. And we see canines. And in the anterior maxilla, we see 4 incisors. However, these two are permanent centrals, so 8 and 9. But the other two are not permanent, but they are primary dentition. What's interesting is that this primary lateral incisors have already undergone quite a bit of root resorption. Look at the shape of the root. Right about here is starting to lose the distal half of the roots. And the resorption pretty much extends into the pulpal space. When I say extends into the pulpal space, that radiographically it looks like it's involving the pulpal space or the root canal, but you know histologically there's a predentin that's covering the pulpal chamber so that it's not a resorption that literally went into the pulpal chamber. Okay, so I wanted to make that distinction. But you can see that there's not much to structure left. These are primary laterals. So let's confirm that the extent of resorption of these primary lateral. So right here, the tooth looks almost dilacerated because of the significant resorption that is sustained at the distal aspect. And if we look at the other side as well, it once again looks dilacerated because all of that is simply resorption. And if you look at the shape of the tooth, this is not the shape of a typical lateral incisor. There's a lot of wear on the incisal edge, and even the enamel thickness, while it's difficult to tell, is thinner than a typical enamel, the thickness of the enamel from a normal lateral incisor. Just look at the enamel from the permanent canine. Additionally, as I said, I will get back to that area. I want you to see that there is a horizontally impacted permanent premolar right palatal to tooth number 3 and primary tooth letter A. And it's horizontally impacted and distally tipped or distally pointed. So it's located right below the maxillary sinus, surrounded by the adjacent lingual cortical plate. Looks like it's been thinned or disrupted along its root. And that concavity that you see is not a pathology, but it's a normal anatomic feature that you often see along the base of the uh, palatal cortical plate. So we see that bilaterally. When I was a resident, at times when we had this kind of limited field of view with a very severe concavity, I almost sometimes wondered if that's some type of minor salivary uh, cancer that's arising from palate, and that's certainly a possibility. But from having seen now thousands of CBCT scans, that just keep that in mind. That's unless you see different signs of erosion and obviously clinical examination as well, most likely that those are that these concavities are normal anatomy. Anyway, so here's that horizontally impacted premolar, most likely tooth number 4. So at this age of 14, we're missing quite a few number of permanent teeth as well as over retained primary dentition. And last but not least, if you look at the shape of these crowns, particularly the canine, do you see that these are a little bit more conical and somewhat narrower than the traditional canines? And these features are also seen in the mandibular dentition, mandibular panoramic radiograph, but we did not capture the mandibular arch for the sake of reducing radiation dose, as this was taken primarily to visualize the impacted premolar, but we were able to extend it just laterally enough to capture the contralateral side. So these are very conical, right? And that was also true, if I recall, in the mandibular arch as well. And that's a very helpful feature for diagnosing patient's condition. So as you already saw in the description or in the title, this patient is diagnosed with ectodermal dysplasia. This may be the first case that I've shared with you in YouTube, so hopefully you got something out of this video, right? So again, it's not every day we get to see patients diagnosed with ectodermal dysplasia, and thanks to this patient, we're able to all learn from this case and expand our knowledge. So again, let's recap some of the features: retained primary teeth and missing multiple permanent teeth. Look at the amount of resorption of the lateral incisors and conically shaped uh, permanent canines and horizontal impaction of this right premolar. Thank you very much for your attention, and I'll see you next time. Take care.